for those presentations. We have Eddie, Kimberly, and Justin on the line. So if there are questions, please do send them through. We also have a note from John Blevins, who says, for further information on the Inter-CFA Faith and Research Collaborative, please contact Robin Gaines Landsey at the University of Alabama, Birmingham. And there is an email address, I think, that can be shared with the group. I believe the presentations will be made available. And so I think some of those links are on there. So I wonder, I don't see any very specific questions that have come through for our speakers, but I wonder, Eddie, Kimberly, and Justin, you've been listening to the entire session. So perhaps one or all of you would like to make a quick comment on perhaps one of the highlights that you've heard today. So maybe, Eddie, what has been a highlight for you, or a recommendation that you would take away from this session? Over.
Again, thank you for allowing me to be part of this outstanding panel. I wanted to highlight a takeaway that I would like, especially with our Inter-CFA Faith and Spirituality Research Collaborative, the effort that we're doing with that, along with our local faith and spiritual research network, which is part of UAB, Center for AIDS Research, Behavior Community Sciences. What we're doing to remove the stigma in those areas, we have collaborated with them with a curriculum that we are removing the stigma. And by doing that, they're being tested in the churches. And on most of those churches, the pastors are getting tested. And we're having people that are HIV positive being part of the speaking bureau. In addition, we are collaborating with our local health department. So, but the biggest piece about that is building those robust and meaningful relationships, building those building blocks in the community, because trust, and that's a big piece, and that's a process. So we have been very successful with some of our leaders and ancestors in the past to continue to expand and build on that. And like I said, in collaboration with the Inter-CFA Faith and Spirituality Research, we have been doing monthly webinars, again, broadening our social media platform.
Thanks very much, Eddie. I think you raised very important points about trust and building solid relationships. Justin or Kimberly, would you like to make a brief comment before I do a quick wrap up? Kimberly.
Well, I'll just say that I am grateful for these questions about how the faith community can engage in these issues in ways that are helpful. In a US American, particularly Black church context, oftentimes what we learned in our study is that when it comes to HIV and AIDS stigma, that our context can often be harmful. And so I've been delighted to be a part of a conversation in which we're thinking about the ways that faith and religious traditions can help reduce stigma, can help bring healing to the world. And ultimately, I believe there's a lot that we can learn in the Black church tradition from this conversation. So I'm grateful for it.
Thanks, Kimberly. Justin, would you like to add anything briefly?
The only thing that I would add is that I am just really grateful to be involved in this dialogue. And as I think about, sort of the ending the HIV epidemic strategy that is being sort of implemented in the United States currently, these questions of stigma are paramount. And I think that, one of the opportunities that we have to reduce stigma really is leaning on the leadership of those in the faith community. So I'm just really encouraged by a lot of the conversations that we've been having this morning, and just seeing that folks are really committed to doing that work, because we know that those of us that are more on the public health side of the equation will not be able to see the types of reductions in stigma and the associated benefits that accrue to folks living with HIV or who are at risk of HIV without this partnership with faith communities. So just really encouraged by the number of folks that are really willing to do this work, because we know that it's very difficult and challenging in a lot of contexts. So just gratitude for the other folks who are deeply committed to this work.
Thank you, Justin. There certainly are a lot of good people doing good work, and it's great to be able to highlight some of that. So I think just a quick recap, I'll go through some of the things that came out. Of course, the rich presentations and conversations will be captured in reports, and so I'll just highlight a few things. We heard really a lot around the issues and access to HIV services and the impact of the COVID pandemic on that, and some of the initiatives that have been undertaken to try and ensure continuity of those services. And I think that really fits under one of the themes of this conference, which is about increasing access and making sure that access is not lost for those who already have it. We also heard very much very clear recommendation from our colleagues at UNAIDS to work with communities as partners in the HIV response, and of course in the COVID-19 response, just to ensure, of course, a human rights-based approach to any work that has been done. And we also heard from Shannon about promoting an enabling rather than a punitive response to any of the work that we're doing. We did hear a lot about children as well. Thank you to the question that brought that up and brought it into the limelight again. We talked a bit about the learning from the lessons learned through the HIV response with regards to stigma and the specific role that the faith leaders can play in combating that stigma, not just with HIV, but with COVID too. Brings a whole new lens to the stigma story as well. We also heard from different participants about the need for more networking among faith-based organizations, and also the need to really enable faith-tailored research among faith communities. And I think I'm going to stop there because I don't want it to be a very long list, but it has been a very rich discussion, and we've had really wonderful presenters and panelists, and I want to thank everybody for taking the time to be here today, to listen, to participate, and of course thank you to our speakers for being here and presenting. And I believe that as a closing to this session, we are going to hear Michelle Nganga from Nairobi, Kenya, a child prayer in the time of COVID. And so from me, I wish you a good rest of the day wherever you are. And thank you. It's been a privilege to be here.